All right, good evening, and this is a presentation on DID, or Dissociative Identity Disorder, by yours truly, Noah Jones. All right, so you might ask yourself, what is DID? DID just stands for Dissociative Personality or Dissociative Identity Disorder, which is formerly known as Multiple Personality Disorder. It's a complex mental health condition where an individual develops two or more distinct personality states, typically referred to as alters, and these personality states can differ in behaviors, memories, and even emotional responses, and they can take control of a person's awareness at different times. The disorder is commonly linked to severe or prolonged childhood trauma, which leads the mind to create alternate personalities or identities as a protective coping mechanism. People with this condition often experience significant memory gaps, feelings of detachment from themselves or their surroundings, and challenges managing their relationships and daily responsibilities. So, now here are the causes of DID. So, as mentioned before, severe trauma and responses to trauma are some factors, because DID is a response to overwhelming stress during early childhood, such as physical or sexual abuse, also neglect or other traumatic events like war or natural disasters. And the development of separate identities is a coping mechanisms to deal with the overwhelming emotional and physical pain of the trauma. However, there could also be some neurobiological factors that come into play, because some research suggests that altered brain structure and function in certain areas, like the hippocampus and amygdala, can be associated with the disorder. And so, who's at risk of DID? People who have experienced severe, prolonged, or repeated trauma during childhood, such as physical, sexual, or emotional abuse, are prone to DID. And other factors, as mentioned before, include exposure to events like war or natural disasters, traumatic medical procedures, and a family history of certain mental health conditions like anxiety or depression. Emotional and physical neglect are also major risks of dissociative identity disorder. And so the symptoms are disruption of identity, which just means that the presence of two or more distinct personality states with unique names, characteristics, and mannerisms. There can also be gaps in memory, with amnesia for everyday events, personal information, and traumatic experiences that goes beyond ordinary forgetfulness. There's also depersonalization, a feeling of being detached from oneself, like an observer of one's own life, or having a sense of unreality or fantasism. And derealization, or the feeling that people and things around you are distorted or not real. And other symptoms include depression, mood swings, anxiety, panic attacks, suicidal behavior, self-harm, sleep disorders, and eating disorders. Now, there are a few kinds of therapy for it. There's biomedical therapy, and even though there are no specific DID medications, medicines like antidepressants, anti-anxieties, or antipsychotic drugs can be prescribed to help manage the co-occurring symptoms like depression, anxiety, and mood instabilities. And biomedical approaches like neurofeedback and electroconvulsive therapy are used in the most severe of cases. Biomedical treatments are, in fact, more effective when used with psychotherapy, as they help to stabilize the patient and cause better engagement with the therapy. There's also talk therapy, and talk therapy, also known as psychotherapy, is typically the launchpad treatment for DID. It involves a mental health professional informing the patient of their potential treatment options, and the therapist will help the patient understand what the causes of their trauma could be in order to help them understand what they're going through better. And as time goes on, hopefully the patient will trust the therapist more and more and open up about what's troubling them. There's also active therapies. So active therapy techniques for dissociative identity disorder focus on trauma processing, emotional regulation, and identity integration using a combination of talk therapy and creative methods. So some common techniques include trauma-focused therapies like eye movement desensitization and reprocessing, and cognitive behavioral therapy that can reframe your thoughts to help you process trauma. And there are also therapies such as dialectical behavioral therapy that help build skills to manage emotions and distress, while creative therapies like art therapy, which is the image in the middle, can help address the body memories. And these are the source cited. All right, that was my presentation on DID.